The first question I always get is, wait a minute, SAFELipo, what's so safe about it? Well, it's not really that we're saying it's any safer, although it is a very safe procedure. SAFELipo is really just an acronym for separation, aspiration, and fat equalization, so SAFE. And this is a multi-step approach that's basically a non-thermal way to comprehensively treat the fat of the body. And that can be by a specific way to perform liposuction, fat grafting, or fat shifting, all within this SAFELipo world of a processed approach. It's very different than just normal liposuction or some of the other forms of liposuction that are out there. Also, it's non-thermal, so we don't have that risk of burns and some of the long-term problems that we've seen with some of the thermal devices. This is usually a circumferential procedure all the way around the trunk, because no one comes in and just says, well, I just want a little bitty bit of fat taken out, or that's very rare. Usually they say, hey, can you just get all this extra fat out? So this is like a 360-degree shrink wrap procedure. You're going to be wearing smaller clothes, your measurements are going to be smaller, waists in general go down several inches, and it's permanent fat reduction. So it's pretty nice, it's pretty dramatic. It's very, very popular. It's something that I've been doing for over a decade now. And I developed SAFELipo for repeat liposuction patients, because the problem is that everybody has too much fat, especially in Louisiana where I live. We like to eat a lot, myself included, and that's one of the problems, and we don't want the fat. The other problem is all of the results that we get from the surgeries that we perform taking out that fat. And we see that in some patients that have had some really pretty bad results from other forms of liposuction. And there's always been this problem with liposuction that even in 35 years of having liposuction, nobody's ever really been able to conquer this problem of the more you suck out, because we all want it all gone, the higher the chance of having a problem like wavy skin or some kind of a contour problem or irregularity until now. And with SAFELipo, you can be very thorough, yet because you're leaving this equalized layer of fat behind, which act as little local fat grafts, you can have a really smooth result, and you can prevent all of those contour deformities from happening. So you get the real dramatic results, yet you don't increase the chance of having a contour deformity. I just presented our SAFELipo research on primary SAFELipo cases on their own without any other excisional procedures like abdominoplasty or any other associated procedures. So this is just patients who came in and had excess fat and got SAFELipo by themselves, and that was just presented here for the first time at the Aesthetic Meeting 2014, talking about outcomes and complications in SAFELipo. And what that study showed was very dramatic results, 100% happy patients with no residual areas that needed to be treated again, and also a 0% contour deformity rate and a very, very low complication rate, all of which were very minor. The most common areas to have SAFELipo performed are the most common areas that people have fat, which are the abdomen, the flanks, the back, the hips, the lateral thighs, the front of the thighs, the middle thighs, the knees, under the neck, the breasts or outside of the breasts, and in males, gynecomastia or moobs, man boobs, and all around the spare tire area. So those are pretty much the majority of the areas, which is pretty much everywhere.